Pinanood ko ang harang mo. Thank you so much, guys. Welcome to my YouTube channel. Yeah, buffering kasi nga, kinuha ko lang yung link ko, ha? Wait lang. What's up mga mga Kenyos at Kenyas? What's up, Kenyos at Kenyas? Good evening, good afternoon, good morning. Ang sakit ng aking singaw. Hindi. Meron tayong pasok mamaya. Busy ngayon kasi Wednesday. Araw-araw naman busy sa fala. Ay. Ang dami ng bagong menu. Nahirap na ako magkabisa. Sakit na. Nagkasing ako kasi nagunting yung labi ko. Sugatan. Nung inoperahan ako. Rin nga. So, okay lang yung tatlo na nanonood. Wait lang. Wait lang, ha. So, ito na nga. Goodbye, Karsaya. Hello, 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 hello. Sakit nun. Sakit yan, Kuya Vlad. Ano nga ba ang dapat iwasan natin, guys? Thank you so much. Ano ang dapat iwasan? Ano ang dapat iwasan sa sa mga YouTuber yan, sa mga bagong YouTuber, guys? Unang-una, mag-iwas kayo sa mga bogus YouTuber. Nandiyan ka pa ba, Kayos? Andiyan pa ba kayo guys? Wala na sila. Nawala si Vlad, tsaka si Bear MCTV. So ito guys, mga kailangan iwasan. Una-una, yan, kung di man kung mapapanood nyo na naman to, mapapanood nyo naman din to eh. Ang una-una guys is yung mga bogus, yung mga nagbobogus sa inyo. Ganto, senaryo. Maraming nauuso ng mga pag-games sa YouTube. Mga pag-games na kung saan sasabihan ka ng mga mabubulaklak na pananalita. Tulad ng, bibigyan kita ng banana. 50 banana, 30 banana, 10 banana, 5 banana. Bibigyan kita. Siyempre, tayo naman, siyempre small YouTuber tayo, pupunta tayo doon. Pero, oops, it's a prank. It's a prank. Hindi ka talaga bibigyan ng gagamitin ka lang niya para sa views niya, para sa WH niya. Pero, it's a prank. It's a prank. Ganun yan. Pangalawa, yung mga bogus na YouTuber, nung uso ngayon, yung mga paangat program. Yung mga paangat program, tayo kasi hindi tayo nagpapangat program dahil hindi naman natin kaya yan dahil hindi naman talaga tayo pang live, pang LS, pang vlog talaga tayo. Most of my videos are vlog. Kaya, wala tayong views. Okay. Pangalawang bogus, yung mga YouTuber na magpapamudmud ng kaperahan. Yan. Mag-ingat kayo sa mga ganyan. O sige, tama. Sige. Manonood kayo. Papamudmud ng pera. Papamudmud ng pera. Pero pag may pera pa ba kayo, nandiyan pa ba sila? So, it's a prank. Nagantay ka ba ng viewers mo? It's a prank. Ganon. Ganon yan. Ganon. Hmm. It's a prank. Hindi ka anuhin yan. Promise. Puro ka-etyosan yan sa buhay. Hindi ka susuportahan yan. Bubugosin ka niyan. Minsan di papapadalan yung ano. Start na mami. Yun nga. Yung una natin is sabihin nila yung banana style. Yung banana style na yon is sabihin sa'yo, pumunta ka sa live ko, pumunta ka dito sa live ko, magkakaroon ka ng 5 banana, 3 banana, at kahit anong ilang pang hayop na banana na yan. Tapos, yun nga, is a prank. hindi ka mabibigyan ng banana. Ginamit ka lang nila para sa double H na, para sa whitey nila, para mag-grow yung whitey nila. Dahil ang intention niya is magkaroon lang ng WH. Pangalawa, yung mga nagpapa-games. Yan, yung mga hindi, yung pangalawa is yung mga sasabihin na, "Babayaran kita, manood ka sa'kin." Ano, naglolokohan na lang tayo sa YouTube? Kaya nga tayo nag-YouTube, eh, siyempre unang-una nag-e-enjoy ka ta's nagulat ka na-monetize ka, so kikita ka na, 'di ba? Alangan naman na nag-YouTube ka nga para mag-enjoy ka ta's maiinis ka pa dahil wala kang pambayad ng viewers mo, 'di ba? Huwag gano'n, my friend. So, babayaran ka daw kunwari, punta ka sa YouTube niya, mag-stay ka, maglaro ka, pero in the end of the day, it's a prank. Lahat ng prank, it's a prank, oh. Thank you so much, Madam Jan's Diary. Gusto natin ano, mga nakikinig lang sila. So, pangatlo, dumadami, dumadami ang namo-monetize channel. Dumadami ang nagla-live. Dumadami ang lahat ng mga eksena sa buhay. 'Pag nasa isang group ka, kung gusto niyo pa mag-grow, kung gusto niyo pa mag-grow sa isang group pa, okey lang 'yun, walang problema. Pero kung nakikita mo yung group na nagiging toxic, like ang gusto lang mangyari is isa lang yung umangat, dapat sa isang group, guys, ang iwasan niyo sa isang group, yung meron lang nag-ano, yung meron lang kinikilingan yung group niyo. Ito lang muna. Yung tipong hindi naman kayo umaangat pero ikaw todo suporta. It's a prank. Prank na naman 'yun, guys, prank na naman. Ang group, eh, nagtutulong-tulong. Nagtutulungan para umangat, hindi yung isa lang ang papaangatin niyo. Magiging prank ka naman, mga prankster yan, mga prankster. Okey naman lahat, guys. Sasabihin pa, eh, tapos kung uutos, mag-ingat kayo dun, ha? Mag-ingat kayo sa taong tatanggapan mo ng pera. Oras tumanggap ka ng pera, ibig sabihin handa kang mag-alay ng buhay mo sa YouTube para sa kanya. Yun ang mag-iingat ka. Kasi oras na tumanggap ka ng pera, isa kang sunod-sunuran sa kanya or sa iba. Wag kang tatanggap ng pera sa YouTube, guys. Tatanggap ka ng ano, dun sa kakilala mo, yung talagang willing na gusto nila na tulungan mo sila. Simple as that. Gano'n. Gano'n ang mga eksena. Ayan, ano pang mga dapat iwasan? Mag-ingat sa mga yes, ayan tama, tama, yes. Iwasan yung mga tao, 'di ba nga nauso yung mga pa-games. Yung mga pa-games na yan. May mga madadayang nagpapa-games, guys. Kunyari malaki na masyado yung pera, mag tapos kunyari may mga pinapahulaan, gano'n. Yung mga pinapahulaan, kailangan maging wais kayo, guys, kasi mamaya may makakasagot diyan kahit malayo pa yung clue. Mag-iingat kayo. Ingat, 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 ingat. Hmm, yan. Iwan na ang tamsak ni Rabe. Hello, Mamutsu. Wala lang, wala lang tayong magawa. Nag-open lang tayo ng berry light para meron tayong harang ng berry light, 'no? Tsaka video. Sakit yung ano ko kasi hindi pa ako uminom ng gamot. Kukuha nga akong gamot. Sorry guys, kumuha lang ako ng gamot. Ito yung gamot natin. Kasi hindi tayo makainom. Ito yung yung may ano pa ako, no, may anesthesia ako, Mamutsu. Nagunting to. Naipit siya. Nagkaroon ng singaw. Sakit kaya. Kakatigya-tigyawat pa ako. Pumapangit na naman ako. Yun dahil sa mask. Sa mask to. Allergy ako sa mask. Ay, Oo, tsumatsak. Hindi naman ako nagagalit. Let's close our eyes, pray the Lord, amen, then laugh. Ganun lang. Nga, yung naiinis ako dito. Kasi nga, butas siya. Nako, toothpick. May toothpick na dyan, Ned. Saglit lang, guys, ha. Ay, award. Bakit tayo gumalaw? Tulong ako. Bot lang to. Bot lang to. Pinatay ako ng bot. Tarantadong bot na yan. Ayun, ang bot yan, oh. Meron pa isa. Sagit lang, guys. Yun na. Dami din talaga. Nasa likod ng ano. Award. Pumasok Pumasok yung channeling. Ay. Opo, dapat. Award. Ah,
Tumakay ako dito ha. Tumakay ako ha. Tumakay ako dito. Lalaglag ko to sa tubig. Sabayan niyo ako. Puntahan niyo ako mag-airborne ko. Marami dito sa akin. Lalaglag ko to. Lalaglag ko sa tubig kayo. Sabayan niyo ako. Dito ako. Sino paano ko namatay? Meron na kalubog.
Sorry guys ha. Sorry guys, sorry. Mega love shoutout sa inyo lahat guys. Ayan, nililinis ko yung ano ko. Sugat ko. Kumusta po ang taong bayan? Dirty.
Nabahan yan. Sabi ko ano eh. Airborne. Airborne. Ilang airborne. Yung mga tawala. Ayun. Tawag na ito. Geko! Geko! Masilaw ako. Dalawa yan, dalawa. Ito pa na. Sa akin kayo. Mulot. Ang mulot. Ang mulot. Tangina nasilaw ako guys. Oh, Diyos ko po. Meron isa doon sa akin. Sige lang. Yan, bidan yan. Ingat lang ha. Uy. Ayun, nasa baba. Magingin yun. Magingin yun. Ayun, nasa container. Ayun o. Ingat kayo, may defender yan. Ingat, may defender. Yan, may defender. Nice one, lakas. Yan, malas yata yun. Hey, malas yun sa akin. Ganyan, sayang. Hindi na ako naglalaki, bro. Oh, ganun to kay Cyrax dati, oh. Ayoko mag-draw, eh. Parang maraming lalabas. Ako, ayun sa problema ko sa Battle Pass ngayon, isa na lang makukuha mo ba? Wala nang sa-trade, diba? Dapat, no? Wala na. Ano ako nung mag-trade. Ingat ha. Babalik ka. Ay, puto, hindi ko na ako nagpagbalik. Ayun, nasa baba sila. Nasa baba sila. Ito, lang yan. Tulong! Pinitak ako, putang ina, shit! Dito sa akin. Yan. Oh. Isa lang to. Saan na initak ako, bilisan nyo. Bubuhay na pala yun. Dami ko pwedeng mapulot ng nawawala. Ayan. Nasarap gamitin tayo. Yan natin kung kaklaps nila yan, boss. Eh, nasa taas, oh. Kaklaps tayo.
Ayan guys, sorry guys. Sorry. Meron lang po akong ginagawa. May ginagawa lang po ako. Grabe nangyari.
Mulot lang yung ano. Tapos na kayo. Wala na kayo mapupulot.
Dr. Shalini Kamodia, and I'm a dentist at Gentle Dental Care in Iwasan. Today I wanted to talk to
Thank you
you
so
about
much.
what you can do after you have a tooth removed to help promote faster and get that area back to normal as quickly as possible. First thing you want to do is, as soon as you leave the dental office, you want to make sure you're still biting on the gauze that they gave you. Applying pressure to that area for 30 to 45 minutes after you leave is really important because it's really that pressure that stops the bleeding. If you notice the area is still bleeding when you take that gauze out, go ahead and take another piece of gauze, put it in that site, and bite down with some pressure again. If you don't have any gauze, that's okay. Find a tea bag. Any kind of tea will do, and bite on that tea bag. The tannins in the tea will actually help constrict the blood vessels, and the pressure you're applying will help stop the bleeding. The next thing we want to address is the swelling. It's normal to have some swelling after you have a tooth removed. Generally, that swelling will increase until about the third day. But everything that we can do in the first 24 hours to minimize that swelling will make you feel better during the healing process. So taking an anti-inflammatory medication, that could be ibuprofen, that could be Aleve, whatever you're able to take that you take for normal aches and pains, that's an anti-inflammatory, is going to be the best thing to help minimize the swelling. The other thing you can do is stick to cold foods on the first day. Nothing really hot in your mouth, no hot soup or hot coffee. Anything cold is going to minimize the swelling. So that could also mean putting ice on your face. If you had a tooth extracted over here, go ahead and take an ice pack. 20 minutes on, 20 minutes off will help minimize that swelling. You don't want to disturb the area as it's healing. So you don't want to suck on any straws. You don't want to be smoking. That's going to disrupt the blood clot in the healing process. And you don't want to really eat anything sharp or crunchy that could get stuck in that hole during the healing process. It usually takes about 2 weeks for the gums to heal over completely. So during that time, you want to make sure you're keeping that area very clean. That means after the first day, brushing gently in the area to make sure you're getting food out of that socket. And every time you eat after the first day, you want to gently rinse with some salt water. That's going to help get all those particles of food that get stuck in that area out after you eat, and that will help promote faster healing. So if you have any questions about what to do after you've just had a tooth removed, the best thing to do is really call your dentist and ask them if you don't remember what they said. And if you have any questions for us, please give us a call.
you got this tooth that is causing you all sorts of pain. So you go to the clinic and get this troublesome tooth out. You come home really free from
Sakdan, thank you so much. Sorry po kasi
you wake up and oh, you feel this massive pain just radiating throughout. But you know, just shut it off for sure like that. It's painkillers, sleep on. But then comes the next thing and another. The pain doesn't seem to go down. Rather, it feels like it's getting worse. And you think to yourself, oh my god, I can't go on like this forever. Have dry socket. Hey guys, David Slot here, and welcome back to another dental session. Dry socket is a
hello everyone.
10. I'll probably say this will be on like 12 because the pain is so bad. It's gonna force you to literally give all your attention to that pain. But hey, the good news is
Sinabi ko na kanina kung paano gagawin ng mga bogus na yan.
procedure is just that pencil clean the area and place some medicated dressing or packing into the socket. And the pain goes away. You probably have to come back once or twice more, but I'm sure that you still have to go back to the clinic. Procedure is just that pencil touching up the needle anesthesia and clean the area and place some medicated dressing or packing into the socket. And the pain goes away. You probably have to come back once or twice more, but I'm sure the pain that you just got relieved will be no brainer for you to come back to this extra work. But of course, there's some brave souls out there who just go back to the clinic. So here's something that you can do. But I definitely wouldn't recommend this at the extremely traumatic, super, super painful state. You don't want to
Thank you.
and put like a drop or two of a clove oil into a clean cotton swab and gently apply it to the area. But then again, I do not recommend this because one, I don't know how well you can clean this area when you move the product. Second, I don't know how scale of stuff is at the end. And this apps or any mistakes that you do during this time may cause infection and can usually go on. So to get this dry socket, we'll simply prune it. So when we pull your tooth out, the area that was open now is open. So over time, it builds a blood clot or kind of like a scab, as if like if you were to cut arm and singles form. You know that means it's just like that. In our mouth, when the tooth comes out, the whole blood comes up together and forms a scab. But when the scab comes off, just like as if you were to pull versus scrape the scab off your skin or your arm, it will hurt a lot, right? So the same way, the scab now comes off the area that's exposed to the air, water, food, anything that you're putting in your mouth, and it hurts like crazy. That site, that area has bone and nerve, and those are the ones that's exposed to air, fluid, you can't really see it, but I'll show you it's there. And then it comes into play. So to prevent the scab and to pop off the socket, we help avoid some changes of pressure in your mouth, including those sucking motion, like straw sucking or smoking or fitness, etc. No harsh movement is going to give you minimum 24 hours clenching or handstand, any exercise. I'll give you 10, and I want tell you about this for 24
Thank you
hours.
so
Now, we don't do
much.
no alcohol because that does prolong the healing process. And we also tell you to avoid any mouth rinses that contain alcohol because the alcohol in the mouth rinse tend to dry up our mouth. And we want your mouth to be moist so it can help you heal faster. We tend to prescribe you with a mouth rinse or use a salt water rinse, which works just as well as to clean out your mouth. Of course, you want to rinse very gently. You want the blood clot or the scab to form into that socket, and you don't want that scab to come off your socket. You want that scab to stay and then heal the area. During a healing phase, the area, the socket might look kind of grayish or yellowish, but don't worry, it's a normal thing. It just means that it's healing. So when it comes to dry socket, you don't really notice till like day 3 or 4 post treatment. Day 1 and 2 is when the scabs form, and day 3 and 4 is depending on how you kind of take care, maintenance your mouth. This is when you know if the scab came off. Oh, you will know for sure if you got it or not because you have this unpleasant taste in your mouth. The smell isn't that great. Pain just radiates from your teeth to your temple, your eyes, pretty much the whole side of where the dry socket is located. So you will know when you have it. This all sounds scary, and I definitely don't want you to have it. But chance of you getting a dry socket is relatively pretty.
Pinapakinggan ko 'tong parang pagalingin yung ano ko. Shoutout naman diyan, ba't ganyan itsura mo? Hello, Madam Ses o Vlog. Madam na nga yan, monetize na.
Chance of you getting a dry socket. So you don't have to worry too much about it. But if you get it and if you think that you have it,
So, ito nga, kasi nga pinapakinggan ko yung ano, na mali ako ng tanggal. Kala ko kasi madumi yung wisdom tooth ko, yung grayish na yellowish na ano, tinanggal ko. Eh, yun pala yung scab nung tooth ko, para gumaling siya. Well, hindi na ako namomroblema sa kung ano man ang mga nangyayari sa mundong ibabaw na sabay-sabay nating ginagalawan. Dead man na ako sa mga nangyayari. Tawanan mo siya, deads. Ganun lang. Hindi siya, kailang, ano siya, normal siya na namamaga.
Is fresh breath a challenge? Mentos freshens you behind the mask. شريكي في مشهد اليوم هو ببند كريم المرطب الذي يعتني ببشرتك.
Oo nga, hindi ko nga alam, akala ko madumi. Siyempre, hindi ko natin.
Hi, my name is Dr. Charlotte Melodia, and I'm a dentist at Dental Dental Care in Iwasan. Today I wanted to talk to you about what you can do after you have a tooth removed.
Oo nga, yun yung process of healing
what are the
niya.
instructions?
Yung may yellowish na grayish, akala ko dumi siya.
I'll first tell you about normal extraction. With the wisdom tooth, normal, straight, removed. The only thing is that hole, that socket, what we say extracted tooth area is open. So food particles might go in. So take that precaution. That food particle doesn't stay there. If at all they go in the socket, there is a blood which will not allow it to stay there, it will come out. When we do surgical extraction, we close the gums with the suture. And the one question which always patient asks us is, how many sutures? It's not the number of sutures. Is that closure is very important. When you close completely, nothing will go inside and there won't be post-operative inflammation or infection. So the first instruction immediately after extraction is
Kasi sa akin, hindi naka-close, bukas siya eh.
and then you to give pressure. And when you give pressure, due to pressure, the bleeding stops. And the clot formation takes place. That is what we want. We make you wait for half an hour, 45 minutes. If there is no bleeding, then we tell you to. When you are waiting, we allow you to apply ice so that you won't get swelling. Or sometimes ice also helps in stopping it. So that ice application has to be continued every hour or 2 hours for 5-10 minutes so that the swelling is. Then what to eat? Till the injection effect is there, don't bite because that numbness, you won't understand the cheek has come between or tongue has come between and you will just cut the tongue or cut the cheek. After that, when you go home, as I told you not to bite, but you can take chilled cold drinks, milkshakes, etc. so that you get some strength and that cold fermentation from inside will not allow it to come out. As the time passes, after half a day or so, couple of hours, you can have soft diet on the other side. But if you are removed on both the sides, then only have chilled drinks or milkshake, etc.
And then when you're removed on one side, evening you can chew little bit soft, very soft diet. But after eating, don't rinse your mouth. No, that will break the clot and bleeding will start. So when you do on the first day, there is no gargling, no rinsing vigorously. You take the water, keep it in your mouth, and just leave the water down. Force it out. The force of the water. Don't drink your chill drinks with a straw because when you suck it, you might disturb the clot and the bleeding might start. So have chill drinks for the first day, soft diet, not and room temperature, not hot, not spicy. Sometimes spicy can affect the incision area. Second day when you wake up, you might find swelling. But that swelling is not due to problem here. When you lie down, there is more circulation towards the head. When you lie down, there is more circulation towards the head, and that circulation gives that swelling. As the day passes, 1-2 hours, the swelling will go down. So don't get worried that too much of swelling as you wake up. There could be oozing, there could be blood on the pillow also sometimes, but that blood is this much saliva. Don't get worried that it's only blood. Of course, we give you medicines before the extraction also, and continue those medicines after extraction. Medicines depends on the dentist and you. What suits you well, only your doctor knows. So they give you medicine as a painkiller for inflammation, that is for swelling, and for the infection that should not happen. So these are the medicines they give. They give medicine. Please complete the course. Don't stop in between. So if you want to do any stoppage, ask the dentist. You don't have to brush that area. In fact, that day avoid brushing, but you can use mouthwash just to keep in mouth and just use your finger to clean your teeth on that night. Next day, soft brush, not in the area of extraction, all over. After 2 days, you can brush everything, but see that your brush doesn't touch the sutures. Now, we have seen patients, they come, doc, I can't open my mouth. What they have done is, with the scare that, if I open my mouth, my sutures will open. They don't open their mouth and there is a trismus, that is muscle becomes spasm, you can't open it. So from the extraction onwards, do a little bit of it. Don't try to open too much, but don't try to close also, speak with closing your mouth. Just sit normally, open your mouth, and when you do gargle next day, when you do warm water gargling, slowly, and then spit out. And when the warm water is there, and when you spit out, that time you try to open your mouth because there is a hot fermentation. The saline water should contain salt, but if you have blood pressure, instead of salt you can take mouthwash. But that will clean and inflammation will go down. And then rinsing has to be done throughout the day, every couple of hours, so that you keep that area clean. There's one complication which people face is called as a dry socket. What is dry socket? Is there's no blood inside. And there's no blood inside, the blood helps us in healing. And if there's no blood inside, the socket is dry and you get some pain. We have got solution for that also. So these are the few complications and precautions one has to take and post-operative. Subscribe our channel and click on the bell icon to get the notification on the latest video on dental healthcare. Live now, live healthy, only.
What is dry socket? I get that question a lot. Dry socket is no fun, I'll tell you that. It's also pretty common when it comes to extractions, especially lower wisdom teeth. And everybody's heard about it. Everybody knows a guy that had a bad dry socket experience. It's what scares a lot of people away from having their wisdom teeth taken out, or what makes them nervous when they need some sort of extraction done. Well, dry socket is when the tooth comes out, just like if I cut my arm and I'm going to have a scab form on my arm. A scab forms where the tooth came from too. We don't call it a scab in the mouth, we call it a blood clot. It fills up where the tooth used to be, and it firms up over the course of a day or two, and it sits there and it starts the normal healing process. What a dry socket is once that clot's there, it gets dislodged somehow. The most common reason is smoking. Somebody goes home and they smoke a cigarette. not only is it the toxins in the actual smoke, but it's the suction of pulling on the cigarette. So the same thing can happen if you use a straw for a few days right after an extraction. We really encourage you to not use straws. So if you go get a milkshake or a smoothie or something afterwards, that's great. Just eat it with a spoon, because that heavy suction when you're pulling on a straw can dislodge that blood clot. Also, if it's in the first 24 hours or so of your surgery, after your surgery, you don't want to do any heavy rinses, heavy spitting, heavy swishing. If you feel gross or something after you've had your wisdom teeth out, that's fine and okay and normal. Just get a wet washcloth and wipe out your mouth instead of rinsing and spitting for that first day or so. Let that clot firm up. It's just like if you sat there and picked that scab on your arm over and over, it's never going to heal right. So when that clot dislodges, if it does, we've got exposed bone in there, and that hurts like crazy. It's no fun. It's really unpleasant, and it lasts for about 2 weeks. And there's not a lot of treatment to be done for it. Yes, you can come in and we can put kind of a medicine down in there, and we can give you painkillers and things like that. We can numb you up, but who wants to come back to have us poke around in the thing that really hurts? No one wants to get another injection. We really prefer not to give you a bunch of painkillers on top of the ones you're already taking. We can avoid these things if you follow our instructions. But there's also a couple really helpful things that we do here. We try to go above and beyond on your average extraction here, which, I try my best to give everyone a very easy extraction experience, and a dry socket is not an easy experience. So one of the things we do is we place what's called platelet-rich fibrin. Make sure you watch my PRF video where I go into more detail about that, but it's a preformed blood clot formed from your own blood that's very easy, and it basically jumpstarts the whole healing process, and it really, really lowers your chance of having a dry socket. So it's very, very helpful. We find that folks have a really good experience when we do that, and we do that routinely here. The other thing that we can do is if it's a tooth that we're planning on putting back, so it's not a wisdom tooth, but it's, say, a molar over here that we want to put back, a lot of times what we'll do is we'll do a socket or site preservation bone graft, meaning the tooth comes out, we fill that right away with bone to give us a really good chance at an implant shortly thereafter. And what that does is that has now filled up that socket, so you can't get a dry socket. We've already covered it and protected it, so we can keep you from having that experience. So that's a little background on dry socket. We have a really good track record with all those little tips and tricks that I just gave you of not really experiencing many of those.
Today we're going to learn my 6 tips to help you with a fast wisdom tooth recovery and eliminate it. I've used these same tips to avoid using any pain medication when I had 3 of my wisdom teeth out a couple years back. I'm using it right now with the fine techniques after I just had my last and final wisdom tooth. And in this video, you'll learn my favorite tips and hacks.
Ang hirap kasi guys, tas may singaw pa ako, hindi ako makanganga. Anong araw na ba? Anong araw na ba ngayon? Wednesday. Kung Wednesday na, Sunday, Monday, Tuesday, Wednesday. 4 na araw na eh. Yun nga guys, maraming salamat guys sa pagsama niyo sa akin, no? Sorry, hindi ko masyadong naiiksanahan yung mga sinasabi ko. Ito pala yung blood clot.
Ginarin mo ba?
Kailangan talaga inumin ko to. Mouthwash ko to eh. Konti na lang eh. Wednesday nga. Yung 4 na araw na siya. Nag-heal naman siya guys. Kaso akala ko dumi siya. Yung pala normal pala nababaho yung hininga mo dahil nga butas siya. Normal pala siya. Yun nga guys, thank you so much. Das na harang. Inis ako. Ito dapat pang garbage. Buti na lang bumili yung kuya ko ng pang gargle, tapos mag-aasin daw ako. Nag-final harang ako. Hey guys, thank you.
Mahirap yan.
Hindi ko tuloy na ano yung topic po.